turn to today's data. Today, unfortunately, 1,733 new cases in Ohio. Shocking number. The 10 highest daily new cases reported, 10 highest daily cases, 9 have been in the past 3 weeks. Today's new case report is the highest daily count we've reported. So that is certainly not good news. If you look at ICU admissions, these are up a little bit above the 21-day average. Hospitalizations are up as well, and the deaths are running about the same as the last 21-day average. So let's look at the next one, Eric. Number of confirmed COVID-19 patients that are currently in Ohio hospitals. In other words, the number who are there as of yesterday remains a very high number. As you recall, we said that Tuesday we had the highest number of people in the hospital that we've ever had from COVID. So those are not good trends. We do, however, and we don't have a slide to show, but we do, however, continue the trend of seeing fewer people coming in to the emergency rooms who are complaining of COVID-19. So that is a good sign. Now, let's go to the new map and take a look at what it is. So, we have good news and bad news. What we're seeing is fewer red counties, and we'll talk a little bit about that, and that certainly is very, very good news. What we're seeing, and we'll get into the details in a moment, but the urban counties that have had the mask orders the longest are seeing a significant decrease in where that line was going. And so they're still at a high rate, but that rate increase has certainly been dramatically slowed down. And that has occurred at a time when the mask order has been on for a significant period of time, and when the compliance from people, just anecdotally by looking as you go around, and as reported to me by mayors and others, that compliance rate has gone up significantly. And that is no accident that those two things are occurring together. The bad news. The bad news is that we have a lot more orange counties and a lot fewer yellow counties. And so what this means is that it's spreading out, and candidly in the rural parts of Ohio, the mask wearing is much less than it is in the urban areas. And that is one of the reasons that you're seeing this spread, and that spread will continue. As Dr. Birx told me this last weekend, Dr. Birx from the White House, Trump administration, told me, she said, look, if this will not slow down unless something slows it down, and mask wearing will slow it down. So that's the bad news. I'm going to go back and have Eric, if you could show going back to the first map we had. Again, you kind of get a picture, a lot of the yellow counties. A lot of the yellow counties, fewer of the reds. All right, let's go to the next one, Eric, on July 9th. Again, you'll see a little change there, a few more red, and a few more orange. Then the next one, Eric. Again, the red is filling out. Again, seeing some more orange. Let's go to the next one. July 23rd. And let's go from 23rd to the present then. So you can see the change. Again, some good news and bad news. Bad news is spreading throughout the state of Ohio, and we've got to slow it down in the rural areas. The good news is we're making some progress in the urban areas. So let me just go through this. We have 13 red counties this week, which is 10 fewer counties that are red than last week. So that's very good news. Let's look at Allen County. Allen County last week was on the watch list. It's hitting fewer indicators than in previous weeks. However, the cases have continued to increase in Allen County, although the increase is not as rapid. Increase over in Allen County, the increase is not as rapid as it has been in the past. Things are moving in a better direction. Residents of Allen County, we just urge you to continue to work to mitigate the spread of the virus. Of the 13 red counties this week, 8 of them remain in red status simply due to the meeting of the CDC's definition of a high incidence of the coronavirus, which, as you'll recall, is more than 100 cases per 100,000 residents over a 2-week period. Let's look at the counties of Allen, Cuyahoga, Erie, Fairfield, Franklin, Hamilton, Licking, and Lucas. These are the counties, as I said, these are the counties that are there because of a high incident number. So what it means is the rate of increase may be slowing down, not as many indicators, but they're over that level. Some of these counties are seeing cases decrease, others are increasing, but all remain at the level where the CDC considers spread of the virus to be high. For example, Franklin County still has 184 cases per 100,000 over the last 2 weeks, well over the CDC's high incident threshold. These numbers have improved. They're going down, but they're still high. We have fewer red counties this week. This week we have also, as I said, have our fewest number of yellow counties. When the system was launched, 54 of our 88 counties were yellow, the lowest level of spread. Today we only have 23 yellow counties, less than half of that original number, so they are moving up. Only 12% of Ohioans today live in a yellow county, 12%, while 44% live in red counties, and another 44% live in orange counties. Again, good news and bad news. Allen County, briefly, those numbers are up, but there is some good news there. Allen County dropped from the watch list this week. Earlier in the month, Allen County had several outbreaks that drove their numbers higher. However, what they're seeing now is an elevated level of cases that are being driven mainly in Allen County by family gatherings and community spread. Cuyahoga County. Cuyahoga County, the good news is that the number of cases per 100,000 is down. Red, though, for the 5th week. They haven't had large outbreaks, but many of their cases are tied to smaller events in Cuyahoga County: graduations, birthdays, card parties, etc. The health department there has received more than 4,000 complaints about staff and patrons not wearing masks in area businesses. Although, again, as you observe in Cuyahoga County, I think the incidence of wearing is going up, which is a good thing. Erie County remains high because of the number of cases per 100,000. And just to give you an idea, Cuyahoga County, as I said, is 139. Erie County is 126, which is kind of a shocking number. Erie County has had some outbreaks related to health care and agricultural settings. County residents also have been affected by outbreaks in neighboring communities. Fairfield County. Fairfield County is down a little bit. That's good. They're at 151 cases, though, per 100,000. That's still a very high number. They've had outbreaks connected to backyard parties. There also was a wedding 2 weeks ago that they're investigating that has several confirmed cases. Franklin County. Franklin County is down. Again, good news. 184 cases per 100,000 residents in the past 2 weeks, which is still a very, very high rate. They've had outbreaks connected to a behavioral health center, assisted living facilities, and restaurants and bars. Hamilton County at 114 cases per 100,000. They are again down, which is good news. Outbreaks in Hamilton County are linked to youth sports, workplaces, and long-term care facilities. Licking County. Licking County is up. Licking County is up. Red because of high incidence. Licking County has had an outbreak at a long-term care center, and local health department officials are investigating a potential outbreak at a religious center. Lucas County. Lucas County is up and showing very high numbers. Not good news out of Lucas. Outbreaks at Lucas County involve multiple restaurants, an assisted living facility, and a daycare center. They're at 183 cases per 100,000, so that's a high number. Now, let's look at 5 counties stayed red this week because they met 4 more indicators. Those are Henry, Lawrence, Marion, Medina, and Montgomery, which means they are for those reasons. Let's talk about Henry County. We told you last week about a winery in Henry County that had an outbreak from a Name That Tune event. Let me give you an update on that. On July 11th, the winery hosted the event. There were about 75 to 80 people who attended. However, to date, 90 people, this is just sad, 90 people have contracted the disease. All those people obviously were not at the winery. But that's how this spreads. What are we seeing now? What we're now seeing is what we call secondary spread. People who are infected with the virus from the initial event carried on to other people in the community. That can be a spouse, it can be a grandparent, a child, colleague, neighbor, or even a total stranger. Then those people also tested positive for the virus. But they all have a connection to someone who tested positive at the winery. Another important thing to note is this event is far-reaching. Already cases have been traced to 5 surrounding counties, and health department officials think there may even be more. Look, the purpose is not to pick on the folks at the winery or to say that, you know, what was going on there it was necessarily bad. The point is that in casual events, when we're having fun, this thing can spread, and we just have to be very, very careful. Lawrence County, clear down at the southern part of the state, met 4 indicators, including sustained increase in new cases and in outpatient visits for coronavirus-like illness. Again, an early indicator. County moving in the wrong direction. Lawrence County has had several outbreaks that are connected to funerals, a church camp, a restaurant, and long-term care. Marion County met 5 indicators, including a sustained increase in new cases and also a sustained increase in emergency department visits. Again, early indicator. So while in the state as a whole those visits are going down, Marion this last 2 weeks has gone up. The county has also had outbreaks at long-term care facilities during the past reporting period. Medina, they met 4 indicators, including new cases per capita. Many of their cases were not in a congregate setting, indicating that the county has community spread. 1 outbreak is linked to a long-term care facility. Montgomery County, they're at 147 cases per 100,000 residents. They met 5 indicators this week, and they meet the CDC's threshold for high incidence of coronaviruses at 147. Let me talk about 2 different situations in Montgomery County. In one instance, 1 person passed it to 6 family members, including parents, a sibling, in-laws, and a child. 4 of the 6 were hospitalized, and tragically, 1 died. In another instance, there's an 18-year-old who's taking care of her 2 younger siblings while their mother is hospitalized with coronavirus. Look, this virus is just vicious. It does not care who you are. We tell these stories not to embarrass anyone and not to really disclose the information, but rather to use these cases to illustrate that it can happen to anybody. And it can happen when you're least aware that it might happen. And it can happen when you're with friends. It can happen with your family. Let me talk about a couple other stories. Tuscarawas County, a healthcare worker who works in Columbus went on a day-long canoe trip, something I love to do with our kids. They went on a day-long canoe trip with friends on July 14th. They all traveled in a van together, and then they developed symptoms. 11 people are on the trip. 9 of them are sick and have tested positive. The cases span 3 separate counties. Mercer County, on July 10th and 11th, a funeral, and then a charitable benefit was held where people attended from multiple counties. There are now 51 people confirmed cases, 51. News, though, is not completely bad. We also talked to several of our counties that, as we've said, have dropped from red to orange. Here's a snapshot of what they've told us. And so a lot of people doing some great work out there. In Union and Clark counties, they're seeing better mask compliance. Businesses are working hard to follow health department protocols. Delaware County health officials couldn't pinpoint a specific reason, but said that their residents seemed to be wearing masks more than they were. And we're thankful for that. Defiance County had various hotspots during the past few weeks, but their health department said their community was quick to tamper those hotspots. Contact tracing and residents following quarantine requests has helped. They also said the community partners paused on activities, stopped activities and events to help slow the spread. So again, shout out to Defiance County and Delaware County and the other counties. Look, it is good. We can control this. We can get on top of this, and these are just some examples of doing that.